This is the knowledge portion of my injectables checkoff video. I'll be talking about the different types of injection routes. So the first one is the intradermal injections. For intradermal injections, you have to use a 25 to 30 gauge needles. The needle lengths are 1/4 inch to 5/8 inch, and you do typically use a 1 ml syringe. You do go at a 5 to 15 degree angle, and the max amount of med to be given is 0.1 mLs. The sites to use for these kinds of injections are the ventral surface of the forearm, the upper chest, and the upper back. So when giving injections or intradermal injections, say it's on the ventral surface of the forearm, you must first pull the skin taut. You must make sure that your bevel is up, and when you're injecting in the needle, you go about 1/8 inch or until the bevel is covered. You inject in the medication until you see a wheal or a bleb. And you must advise the patient not to mess with it, not to apply pressure or to itch it, and to have their results read in about 48 to 72 hours by a nurse. So the next one is a subcutaneous injection. For subcutaneous injections, you must use a 25 to 30 gauge needle as well. Needle length is 3/8 to 5/8 inch. You do use a 1 ml syringe or a insulin syringe, and those are measured in units. The angle depends on how much subcutaneous tissue you can pinch. If you can pinch more than 1 inch of subcutaneous tissue, you have to go to 90 degree angle. If you can pinch less than 1 inch of subcutaneous tissue, you have to go at a 45 degree angle. The max amount of meds to be given with this injection is 1 ml. And the typical sites is the abdomen, 2 inches away from the umbilicus, the backs of the arms, the anterior thigh, and the lower back or upper buttocks. When administering subcutaneous tissues, you must use, so say it was on the lower abdomen and I can pinch more than 1 inch, we will go at a 90 degree angle. So you pinch the skin, we're gonna insert the needle in at a 90 degree angle. While it's still pinched, you release the skin and then you release the medication itself. And then we advise the patient not to massage it, not to massage the site, not to itch the site, and just to apply gentle pressure and to just leave it alone for the next few days. Lastly is the intramuscular injections. For intramuscular injections, you must use a 20 to 24 gauge needle, 1 to 1/2 inch needle length, and the angle is 90 degrees, and you do have to go to 90 degree angle. So the max amount of meds given depends on the muscle. So for deltoid muscles, the max amount of meds is 1 ml. For vastus lateralis muscles and for ventrogluteal muscles, max amount of meds is about 2 mLs. I'm going to show you where those muscles are. So for the deltoid muscle, the way you can find it is if you find the acromion process first, which is right here, you're going to place your finger, you're going to place 3 fingers below the acromion process, and so the site of injection should be right here. You must make sure to go at a 90 degree angle and to use the Z-track method, which is basically pulling the skin firm and then injecting, and then you have to make sure to aspirate before injecting in the medication itself. So you use the Z-track method, and then you aspirate, and then you inject the medication. For the vastus lateralis muscles, you also have to use the Z-track method, and you also have to aspirate. The way to find the vastus lateralis muscles is to place a hand on the lateral condyle, so make an L. You can place your other hand on the greater trochanter, which is right here, and you're going to make another L. The site of injection should be the middle third of the vastus lateralis muscle, which should be right here. And then for the ventrogluteal muscle, the way to find it is you place a hand, if you're on your left hip, you're going to use your right hand. You're going to place your palm on the greater trochanter. Your index finger is going to point towards the anterior superior iliac spine. Your last 3 fingers are going to point towards the iliac crest. Your injection site should be right here. All right, and again, you must go at a 90 degree angle. Use the Z-track method where you pull the skin firm, and then aspirate before injecting in the medication. And that's for both the vastus lateralis muscle, the ventrogluteal muscles, and the deltoid muscles. So for all intramuscular injections. We do advise the patient not to irritate the muscle by itching it, by massaging it. We would just need to apply gentle pressure and advise them to just leave the site be for a few days.